I think to understand how we treat patients with a substance use disorder, it's really important to start with an understanding of how we view substance use disorders. And we really think of these as chronic conditions that need care over a long period of time. So I think a lot of people have this sort of fantasy or this idea that, I can do a 30-day treatment program and then I'm fixed and I don't have a substance use problem anymore. And it's not so much that we don't think 30-day or inpatient type programs have value. In fact, they have tremendous value. Instead, it's that we really recognize substance use disorders as long-term problems. So we think that means people need long-term care for those disorders to be effectively treated. So when we're seeing someone for a substance use disorder, the first step is that we meet with them in the office and we do an assessment and we try and understand what's going on. And while there are some real commonalities for people, there's also a lot of differences, and we think that we can't really develop an appropriate treatment plan unless we know you and we know the ins and outs of your story and we know the ins and outs of your particular situation. Once we understand that, then we basically work together with you to develop a treatment plan. And again, that looks very different for different people. So there's some times where we'll say, look, we think that you actually need an inpatient stay, and that is the next step on your journey. There's other times where we can manage, the withdrawal process as an outpatient. And I think getting through that withdrawal process, getting through that first step is really just that. It's the first step. The problem doesn't go away, unfortunately, after the withdrawal is over. And so we work with people over time to help everyone that we see live a healthy, happy, productive, meaningful life. That does not end when the substance use has stopped. In fact, stopping the substance use, like I said, is really just sort of the first step.